You've made it through the hardest part of bariatric surgery. The initial recovery is progressing, your daily portions are permanently smaller, and you're finally settling into a new rhythm for your life. Part of that rhythm involves a strict daily vitamin regimen. When faced with giant, intimidating medical pills, it's incredibly tempting to grab a bottle of gummy vitamins off the grocery store shelf. They are convenient, they taste great, and they feel like a harmless way to manage your requirements. Skip ahead a few months, and the reality of that choice sets in. Patients often hit a wall of extreme fatigue, and routine lab work begins to reveal dangerous bone loss or even permanent nerve damage from severe vitamin deficiencies. These gummies often pass through the system without ever releasing their payload, while their sugar content introduces a new set of digestive hurdles that specialized medical supplements are designed to avoid. Choosing a vitamin based on consumer convenience rather than medical reality directly jeopardizes your long-term recovery. This diagram shows a side-by-side comparative cross-section of a normal, full-sized stomach on the left versus a surgically altered bariatric pouch on the right. Whether through a gastric sleeve or bypass, the usable stomach is now a fraction of its original size. When we look at the stomach linings, the difference in chemistry is stark. The normal stomach contains a high volume of concentrated gastric acid, while in the bariatric pouch, that acid production is severely and permanently depleted. In a normal stomach, a gummy vitamin behaves exactly as intended. Its gelatin matrix, the structural glue holding it together, melts rapidly in the abundant acid, releasing its payload of nutrients. But inside the bariatric pouch, the environment is too weak to break that matrix down. The gummy remains structurally intact and passes right out of the stomach without dissolving. Because the gummy fails to melt in time, it speeds past surgically shortened intestinal absorption centers. Up to 50% of nutrients are never absorbed. For a bariatric patient, the physical reality of a gummy makes severe malabsorption a certainty rather than a risk. Beyond the structural failure, there is a deficit in the formula itself. Standard consumer gummies are built for average digestion, meaning they lack the clinical doses of iron and calcium that bariatric patients require for basic health. To reach a bariatric target using these products, a patient would have to consume multiple handfuls of gummies every single day. This data scale shows the massive amount of sugar required to reach just one daily bariatric dose of iron and calcium from standard gummies. With each tiny serving containing 3 to 6 grams of sugar, this strategy creates a staggering daily sugar load. When that dense wave of sugar hits your shortened, highly sensitive intestines, it triggers a physiological reaction known as dumping syndrome. Patients suffer through intense cramping, sudden jarring nausea, and severe diarrhea. Over time, these excess calories can even begin to reverse your weight loss progress. Forcing a consumer gummy to meet a medical quota essentially turns a necessary supplement into an illness-inducing sugar overdose. Effective post-operative care requires viewing your daily vitamin intake as a specialized medical treatment. Bariatric-specific chewables or capsules provide the engineering required to support your new anatomy. Look at the difference in this animated diagram. Because these capsules are formulated without a gelatin matrix, they break apart immediately upon contact with even the lowest acid levels, releasing a dense cloud of nutrients. These formulations deliver the high, bioavailable doses of B12, iron, and calcium you need, without introducing unnecessary sugars into your system. Thriving after surgery means matching the engineering of your supplements to the unique engineering of your digestive system. Maintaining these biochemical levels is a lifelong requirement that extends well beyond the initial months of surgical recovery. Guessing at supplement ratios or following over-the-counter trends is dangerous. Your body's needs evolve, and they require continuous monitoring through regular blood work. Managing that level of nutritional complexity is exactly why patients work with the experts at Beltre Bariatrics. Our team provides personalized care plans, targeted nutritional guidance, and lifelong support tailored to your unique anatomy. While surgery changes the body, expert lifelong guidance ensures your weight loss.